And you saw an improvement pretty quickly with him,
Oh,
didn't you?
within 2 days, yeah. It was dramatic.
So from being sick for what? Months and months of 9 months.
9 months.
Just a couple of days.
Right. Right.
And that's
Better.
what's so great. It's actually technology, and yet it's, in a way, the simplest of new technologies.
Yeah, absolutely. And to help us explain this, please welcome Dr. Sudhir Datta, who is on the phone with us. Dr. Datta?
Hello, yes.
Hi, welcome.
Thank you.
Now, you are the head of the gastroenterology department at Sinai Hospital in Baltimore, right? And you performed the transplant?
Yes, indeed.
That is excellent. Can you help? We'd like to welcome you.
Thank you.
So now, Jesse is the youngest one to receive the fecal transplant?
That is correct, particularly through the colonoscope. There is one child reported from Boston where they gave fecal microbiota therapy through the NG tube. But Jesse is the youngest and the only one who has received it through a colonoscope.
Wow.
And so what you're explaining is that some people actually get through a nasogastric tube. So it goes in from up top.
And there's a bit of an ick factor when you think about that.
Versus this came in the colon from the bottom. And that's probably for people out there, they're like, whoa, that's preferable. I don't really want the thought of fecal matter going in through my nose.
Yeah, but the donation, you just kind of sat on the toilet with a little dish, right? It was easy?
Yes, but we have done it both ways, actually. In adults, we have delivered the fecal processed material into the small intestine. We have long scopes now. With the endoscope, you can go down to the small intestine, way down through the mouth, and deliver it from above and deliver the material, which is rich in healthy bacteria, into the cecum and the right side of the colon simultaneously. We have done that, and it works perfectly fine, and the results have been almost 100% success rate. We haven't done it through the NG tube because of that ick factor that you mentioned, because people can vomit it or throw it up, and that can be horrible.
Yeah.
And so this is something I think that is revolutionizing treatment for C. diff colitis. Do you see this becoming the standard of care for people sick from this disease?
Yes, in those patients where the problem keeps on recurring, I don't see any way around it for the time being. I think this is the standard of care because the antibiotics do not resolve the problem. Even the latest antibiotics, which came in the market 6 months ago, is failing in this respect. And in fact, when you talk to the patients, they tell you that the antibiotics do not restore their bowel function to the normal level the way they were prior to getting sick with this infection.
And this, to me, is a fascinating story about the advance of medicine and discovering such, in many ways, a great cure without doing harm. Dr. Datta, thank you so much for joining us.
Thank you for having me, and I'm so happy for Jesse that he has done so well. This was totally unexpected, and I'm just tickled with that, and I'm so happy for him and for his mom. And I think there is a hope for everybody. All the children who have this problem, there is a chance to continue to live on happily after the treatment.
And hopefully people are watching this. Now, you don't want to do this at home.
Nope.
May seem easy. It's a little simpler than maybe a kidney transplant, but you don't want to do it at home.